Hi, okay, so I did actually want to make a serious video addressing my jaw and like surgery and recovery, basically all the things I've kind of been through with it. I'll start this off with an explanation. I have juvenile idiopathic arthritis. It was renamed recently, like a few years ago, I think. Um, from juvenile rheumatoid arthritis, which is what I still call it in my mind. I, I don't really know why they renamed it. It's not really a popular disease among juveniles, among delinquents. But yeah, I haven't looked into it. I don't really care to. But yeah, basically what that means is I have a disease where arthritis, the disease, attacks my joints. So things like your elbows, your wrists, your knuckles, finger joints, my TMJs, which, by the way, when I say jaw replacement, I don't mean this whole thing. I mean like my jaw, like opening and closing. I think there's a joint back here because my neck has been swollen before. That's kind of a side effect of the swelling my jaw went through. And like your shoulders, basically things like that. I think you kind of get the idea. I'll just run through all the joints that I've had affected. I'm losing my train of thought, I'm sorry. What the arthritis does is it basically pumps fluid into the joint and makes it all swollen, which is, I have pictures somewhere that maybe I'll like post on my blog or something that show like what my knee looks like when it's swollen, because that's probably one of the most obvious joints. It really just swells up in size. Like everyone knows when you get your wisdom teeth removed, your face swells up to about like twice its normal size. That's basically what happens with my joints. It's just not really as visibly noticeable as in some other cases. I've actually met other kids with arthritis around my age that have it so severely that they have joints like fused together. Like, I guess in a way I do. Like, my middle finger is pretty swollen. It's not really as affected as it used to be. I don't know if you can tell, but like right on the sides, it's kind of thick and it's really hard in texture. It feels like bone growth. It's some kind of muscle dysplasia. It's not worth paying for an operation though, because it doesn't bother me. It's just there. My elbows, both elbows have been swollen. I recently got them injected. I just got my infusion today for my arthritis. My wrists have been swollen. Both knees have been swollen. My right hip was slightly swollen for a period of time, but it kind of came and went pretty quickly. My ankles have been swollen. My neck, my TMJs, obviously. I'm sure some toe joints have probably been swollen as well, but anyway, yeah, that's about all that I've had affected. And now that you kind of have better understanding of what it is, I can jump into my TMJs. So, I needed it because I had severe deterioration in the left side, and a bone growth was surrounding the joint itself. There was basically no hinge, it was just the bone growth, and then the other side there was no cartilage left, so it was just the joint exposed. I have an x-ray that I recently got from my surgeon that I can kind of explain. I don't actually, yeah. So this is the left side. Yeah. That's the bone growth right there. This thing right here. And then if you move to the other side, there's nothing in the joint here. And I have my wisdom teeth in too. So, but now I look like, after all these selfies, I look like this on the inside. So they cut my joint out, they put in the metal plates, or the metal jaw. They added an artificial hinge, which is partially plastic, partially metal. And then they cut my maxilla, and the maxilla is like this part. This is the mandible, not the jaw. This is the mandible. This is the maxilla. They cut it up here, moved it around because they said that it was actually starting to move with my lower jaw, because my lower jaw, I don't know if any of you guys have known me long enough. Some of you have. Majority of you probably didn't notice, but because you knew me like that to begin with. It was off to the side like this. It was a lot worse, but that's because there was no joint here, so everything moved over to the side. Or there was no cartilage here, so there was no place for the jaws to go. So it all just kind of went lopsided, and my upper jaw, so the maxilla, started actually growing to fit with the lower jaw. So both of them were off to the left side. So they had to correct that, and then that's when they bolted these things in. This is like right where my sinuses are. I think you're probably like, so if this is the left side, then that would be about there, and then that one would be about there, and then the other one would be somewhere over here. And honestly, that's probably the most painful part of the actual surgery that I had to go through. I felt a lot of discomfort like around my nose and sinuses because the plates were swelling up my face, and there wasn't really a lot of room here. Like, my face was pretty tight around here. As for the actual jaw, the most pain I have been experiencing is mostly just from having to rehabilitate it, learning how to reopen it normally, gaining back my motion, my range of motion. Learning how to chew again is probably one of the hardest parts. I struggle with canker sores, which are just those really nasty white sores you get in your mouth. I get them all over the place. I recently had them like at the back of my tongue where you would chew and swallow. So it kind of slowed me down as far as eating and chewing goes. But I was prescribed a cream that actually really helps, so it's not really an issue. But that's a side effect of the medication I'm on for my normal arthritis. What else? Recovery. It was so much harder than I thought it would be. By the way, when I hit 10 minutes, I'll stop and I'll create a part 2 if I have to. Recovery is the hardest part of it all. It's mostly just like staying motivated, staying positive about it, understanding that this is something I have to go through. There's no other option for it. There's no other solution for the arthritis. There is no cure. I have to do this, and if I want to be normal in a few years or months, then I have to go through the hard part. And I've gotten over most of it. The first few weeks, I don't think I was really blogging as much because I was so miserable. I was in the hospital for 3 days. I think it took longer than I was anticipated to stay because I was in a lot of pain and I wasn't eating normally. When I say pain, by the way, I don't mean like jaw pain, I mean like swelling pain. Like, my face was literally twice the size it normally is. I can show you pictures. I think this might have been like the night I was finished with surgery. The breathing mask caused me hell, and yeah, I was pretty swollen. Yeah, that was really hard. There was a lot of crying the first few weeks. I was really miserable. I wanted to, like, I remember I told my mom, like, I want to die. I couldn't do anything normally, and yeah, I'm gonna make a part 2. So see you in part 2.